And I will be doing a basic IV insertion today. I'm section 8 with Sink and Bowman. I am now looking at the patient's mark. I'm looking at patient's name, patient's history, any known allergies. I'm taking the doctor's orders for the IV insertion. I'm going to select the appropriate gauge needle for the medication. Just in case the patient does get a blood transfusion, I'm going to select the 20 gauge IV needle. But first I'm going to get my flush. So we don't have any pre-filled syringes. I'm going to attach a blunt needle to a 10 ml syringe. And I am also going to check my saline for the expiration date. See if it feels fine. I'm going to take an alcohol pad, clean off the top of the saline cap, dispose of that. I'm going to pull back 3 ml of air, pick up the cap,
I know where it is.
one at 90-degree angle. Okay, my name is Samuel Humphrey. Today I'll be performing a basic IV insertion. I'm in section 7 with Sink and Bowman. Okay, right now I'm in the nursing station near the fixes. I'm going to be examining the MAR, looking at the doctor's orders for this patient. I'm looking at the orders and I'm looking at the patient's history, any kind of allergies, latex allergies, any things of that nature. I'm also going to select my appropriate equipment. The IV cath, I'm going to select a 20 gauge, just in case the patient may be getting any kind of blood transfusions or medications or having to go to surgery. I'm going to take a 10 ml syringe, attach it to a blunt needle. I'm going to take my saline, the date, make sure it's not expired. It's not expired, so that's fine. I'm going to take an alcohol pad, clean off the top, dispose of it. Now I'm going to take the cap off, take my needle, pull 3 ml of air in my 10 ml syringe, take out the needle, go in at a 90-degree angle, insert it, push the air in, pull back 3 ml of saline solution, recap, remove the needle, put that in the sharps container. Now I'm going to take my IV extension and attach that to my flush. I'm going to unclamp it. Now I'm going to prime my extension. Keeping pressure, I'm also going to clamp my extension. Put that on my MAR along with my IV cath, my Tegaderm, my tape, my alcohol pads, and my gloves, my pen, and my tourniquet. Excuse me. Now I'm going to go into the patient's room, knock on the door. You told me to come in? So I'm going to introduce myself. Hello, Mr. Johnson. My name is Samuel. I'll be your nurse today. I'm going to identify the patient. Can you please give me your name and date of birth? He identified himself as Mr. Johnson with the correct date of birth, as stated also on his name badge, on his armband. Now I'm going to perform a hand washing technique. Clean my hands. Now I'm going to ask the patient if they're right-handed or left-handed. He told me he was left-handed, so now I'm going to I guess I'm going to select his right hand using a non-dominant hand. I'm going to inform the patient that I will be inserting an IV due to the doctor's orders, and letting the patient know that it's a brief stick, They may feel some discomfort, and asking the patient if he has had any kind of fistulas or dialysis. If he has any PICC lines, anything in his arm. He stated no. It's a male, so he hasn't had any mastectomy. I will hope not. And I'm going to now search for an IV site, most distal. He has a lot of bruising and everything on his hand, so I'm not going to check his hand. I'm going to palpate for a bouncy vein. I found one. And I'm going to ask the patient if there's any soreness here. The patient has stated no. Okay, and now I am going to apply my tourniquet about 4 to 6 inches away from that site. I'm going to take my alcohol pad and clean the site in an inward-outward circular motion. While that dries, I'm going to apply my gloves. I am going to stabilize the vein away from the area I'm going to stick. I'm going to get my IV cath. I'm going to inform the patient that it's going to be a quick stick, slightly discomfort. I'm going to go in, delve it up, and I am going to insert at 15-degree angle. So I get flash. I got flash. Now I am going to thread the cath, the needle. Now I'm going to release the tourniquet, apply pressure, get my extension, put the needle in the sharp container. Attach the extension, unclamp it. Now I'm going to aspirate. I got blood draw, so I'm going to do the push stop method to flush the INT. I'm going to clamp it. Remove my syringe, put that in a sharp container. I'm going to take my tegaderm, also move my tourniquet. Take my tegaderm, place it over the injection site, take off the label. This label I'm going to initial, date, time, and gauge size is a 20. Take that sticker, place it on the tegaderm, away from the site, clearly visible. I'm going to ask the patient if they had having any kind of discomfort, any kind of pain to the site. He says no, he's fine, thank you. You're a great nurse. I'm like, no, you're a great patient. I'm going to also take my tape, my first tape I'm going to secure around the site. Second piece of tape, I'm just going to secure the extension, the patient's arm, so it's not hanging. What's the top? Make sure the patient's still not, having any kind of discomfort. And if things, everything's okay, he said, you're great. And I am going to now chart, remove my glove and chart on the site, the location, date and time I placed the INT, how the patient tolerated it, how many times I stuck them, and the patient had no adverse reactions, any kind of side effects, no pain, no bruising. I'm going to let the patient know I will be back within an hour or so to check on them, make sure they're fine. I'm checking to see if the patient is in any kind of pain, Their position is fine. They have the call light, the remote TV, water, everything for their diet, anything they need. Okay, I'll see you in just a minute, and that's it.